Yes, hello everybody. I was Sam Chiccanetti a few seconds ago. I did not realize that my name was incorrect, but I have changed my name correctly back to Benjamin Seidel. So hello everybody, welcome to UT Health San Antonio. You can go to the next slide. So first of all, being from the Northeast, I will attempt a howdy y'all, but this is our yearbook photo this year, and we welcome you to our program down in San Antonio, where it's been just warming up. By way of introduction, I am the program director. I work at the VA clinically in brain injury medicine and electrodiagnostics. Our department chair is Monica Verdushko Gutierrez. She also is brain injury, long COVID, spasticity guru. We have two APDs in the program, Dr. Aditya Raghunandan, who does interventional MSK, spine and sports, as well as Dr. Maria Palafran, who does brain injury and consultative work. One other person who's a part of the program leadership is also our research coordinator, who is Dr. Michelle Turbovich, who also works at the VA spinal cord. And not pictured here is probably one of the most important persons in the program, Edie, who is our program coordinator. And as you are moving through and applying to different programs, you will rapidly see that the program coordinator is an important contact for students as well as for us as residents and faculty. You can go to the next slide. So my job apparently is to just talk for a few minutes about how much our program has grown over the past few years and all of the wonderful growth that we anticipate down in Texas. Apparently, I'm from the Northeast. We don't have a lot of space, but Texas has a lot of space. So they've managed to build a few new hospitals since I've in the past couple of years. There was a Women and Children's Hospital, which was a $500 million project that opened in 2023, that had pediatric rehabilitation gym. We hired a bunch of new faculty for SCI, pain, and cancer in this past year. We've developed new sports connections with UTSA and expanded our research footprint. If you can go to the next slide, I think that's about the UTSA, maybe. Nope. MSRH first. Then we had another hospital that just opened in 2024, which is a multi-specialty research hospital. It includes a space for MSK and spine interventions. We are also developing a more robust cancer rehabilitation program through the MSRH, where a lot of the cancer rehab is going to be housed. And the framework by which the university has created this is that it is essentially blending patient care and research into a more cohesive unit to make it and facilitate both the clinical and research aspects. Next slide. So that being said, our core locations, which we'll talk about in a few minutes, include a number of different locations that are more or less on the same campus. When I first moved down here a few years ago, I did not realize the massiveness of all of the different hospitals that were all connected, that you could like physically walk through about 5 hospitals without actually having to go outside at all. So I thought that was kind of cool. But UT Health in the VA, as well as University Health, the main hospitals are all connected to one another, including both the Polytrauma Center, which is a separate hospital in the VA, and Audie Murphy, which is the main VA hospital. So within UT Health, we have a few different HOPDs, which are considered hospital outpatient clinics that have dedicated spine center, a newly developed sports medicine fellowship. Within the VA, we have one of the only 5 locations in the United States that has the inpatient polytrauma rehabilitation center. So it's one of the largest in the country. And therefore the neuro rehab, TBI, SCI polytrauma is in terms of federal exposures, one of the best in the country. Apparently, I also made the bill here when I joined in 2023. They were nice enough not to remove that from the slide for the past like 2 years. And university health, we're working on developing some additional fellowship opportunities. As I said, the Women and Children's Hospital is housed under the university system, and then the MSRH hospital, which includes a number of different additional services. Next slide. And then one huge announcement was that UT Health San Antonio and UTSA are merging. And the idea that it's going to be the third largest public research university in Texas, which would elevate San Antonio as both a biomedical and educational hub. The merger is going to take more than until September 1st, but it will be official as of this fall. So really, honestly, the name change probably will only translate to more opportunities for research grants and more visibility. We don't anticipate any clinical changes other than the ability to connect a little bit more easily with the research arms. So certainly, I think it shows that we are in a growth mindset here in San Antonio. So this year we did partner with the Air Force. So we had a really interesting new partnership, so that because we also have one of the largest level 1 trauma centers with the DoD. We also we were asked to participate, and so this year we have our first Air Force resident who started just a few weeks ago. So we're excited about that. And apparently we added our toxicity improvements, which, yeah, all right, bragging rights. I think you can go to the next slide. All right, so I think that's the end of my spiel. Sorry I talked too fast, but I wanted to make sure everyone had an opportunity.
Very good. And just quick question for the host. Do we have until 7:45 or 7:50?
About 7:50 and then 5 minutes for question until 7:55.
Okay, cool. I'll still try to run through my stuff in like 5 minutes. Let me start a timer. Okay. So we already kind of hit on some of our training locations, but as Dr. Seidel said, there's multiple hospitals that are all in very close proximity. I'll show you a map on the next slide, but I'd say the two main ones that we're really at the most is University Hospital, and then the VA, and both of these are literally connected just by a little sky bridge. We have the Mark, where we do some of our MSK spine procedures. Warm Springs, which is more of a kind of private practice inpatient rehab setting, where when we do inpatient rehab there, we are actually just a consult service rather than a primary, but pretty much all of our other inpatient rehab at like the VA, spinal cord injury unit, and polytrauma unit that are both at the VA, we are primary. And then we already talked a little bit about the new MSRH hospital. We'll probably be getting a little bit more like spine pain procedures there. Our Women's and Children's Hospital, where we do our pediatrics rotation, and they also have their pediatric rehab here, is also, I mean, here's the Women's and Children's Hospital, and then this is so it is literally connected to it. And then your intern year, you'll do 2 months at our active duty military hospital, which is the only one that's technically not in the medical center, but that's just for 2 months intern year. So this is showing our medical center. Here we have the stars. This is where UH and the VA where you're predominantly at, and then UT, like the medical school and the UT clinics. Some of them are right here at UT Health, so you can see the school nursing right there. And then the other locations are just a very short drive away. I mean, it's like within a 5-minute drive. You can honestly even walk to a lot of them. So I'd say our medical center is kind of unique in the sense that it's not like right in the heart of downtown San Antonio. It's like probably like a 15 to 20-minute drive away, which is a little bit nicer kind of for traffic purposes, but of course there's still going to be a little bit of traffic. So program structure, starting with your intern year. So we are a true categorical program. If you match here, you'll move here and you'll be here for 4 years. Your intern year, you do your classic, 3 months of inpatient medicine wards. You do 2 months of ICU, one of which is the medical ICU at the VA, and then the other one is the surgical and trauma ICU at that active duty military hospital, BAMC. You do 3 months of outpatient ortho, where you get to work with a lot of the orthopedic surgery residents, but we as PM&R, we are not in the OR. We are just helping run their MSK clinic downstairs, but it's nice because you get a lot of exposure you get a lot of MSK exposure your first year, and you get to do a lot of procedures within your intern year, which is nice. Then you do 1 month of inpatient neuro, 1 month of outpatient rheumatology, and then 1 month of geriatric/palliative care, which is kind of a mix between inpatient and outpatient. And then we get to do one month of true PM&R consults at UH Hospital, which is an awesome experience. So it's nice because day one, or honestly, even before you start, you're a part of the program. You're a part of the family. It's nice because after your intern year, there's a continuity of your training. You don't have to try to learn a new EMR or facilities and all that. You get the opportunity to build relationships with consult services, or even just like the other interns that you're on your medicine team or your neuro team. Like, you will continue to work with them, or at least like pass them in the hallways your following years here. So, and then we also have like a peer mentorship program, or residency families, where a PGY1 and PGY3 are paired up together, and then a PGY2 and a PGY4 are paired up together. But all four of those years, I create a residency family, and it's a nice opportunity to kind of help you assimilate to our program, the people in it, and have a support system behind you that's a little bit more intimate. And then we also have our intern welcome retreat that we often host right before actually starting, or right before the interns start their first year, kind of right after orientation. So this is a photo of our brand new intern class. Typically, we've always had 8 per class, at least for the last several years. But as Dr. Seidel talked about, we added on a new, a 9th position through the Air Force. But yeah, this is all them. We caught them as they were taking a break during their orientation just a couple weeks ago. Our PGY 2 through 4. So I feel like it's fairly standard throughout PM&R as a whole, that you'll do a little bit more inpatient, of course, your second year, a little bit less your third year, and then the least your fourth year. I think you really only do like 1 or 2 months of true inpatient your fourth year. And then your second year, it's pretty heavy inpatient. I'd say anywhere between 6 to 8, depending on if you do any electives that second year. But so you'll do general inpatient rehab at UH, which is called our Reeves Inpatient Rehab. We have a polytrauma unit at the VA that Dr. Seidel talks about. There's actually 5 kind of model programs in the USA, and we are one of them, particularly our disorders of consciousness program. So it's great to see a lot of those patients and truly learn about disorders of consciousness and be able to watch a lot of them emerge. It's pretty incredible. Then we have a transitional rehab program at the VA called P-TRIP. We have a dedicated spinal cord injury at the VA, pediatrics at the UH Women's and Children's Hospital. And then, as I said before, Warm Springs, which is that private practice where we are more of a consult service there. So you get a taste of being in more of a community-based center, and then also private practice, and what it feels like to be primary versus a consult service. So, and then your typical outpatient clinics, and you get 4 weeks of elective built into the schedule. And then there's also additional time available, and there's also a research elective. So in terms of procedures, as PM&R, we're required to complete 200. Typically, our residents complete at least 300. By the time that we graduate, and I'll be doing my 3 months of EMGs here shortly, kind of back to back, to really kind of hammer in, how we do those and how to do them correctly. And then the remaining procedures, that's pretty standard throughout PM&R.
5-minute warning.
Okay, I'm just gonna move on. Our call schedule is pretty nice. Intern year, you don't have any. Second year, it's like 12 to 13 24-hour call shifts. You are only in-house after 8 p.m. You have to stay there overnight. PGY 3 is just a Friday evening, and then fourth year, just backup call. So really not bad, especially for having 8 or 9 residents per class. And then night float, which a lot of people honestly prefer, Monday through Thursday. Basically, it's about 4:30 p.m. to 7 a.m. And you're just, you're there making sure that the ship doesn't sink, essentially. Robin, just take the didactics.
Yeah. I'll try to go quick through this. There's not much to like. I'll just hit the highlights. Best part about didactics is that as a PGY one, you get to come to this. I think that was like one of the most best parts as an intern was being able to be a part of the family and like actually interact with the twos, threes, fours as I was going through intern year. Weekly assignments, journal club that goes between a junior and a senior resident, helping you through that, and then a faculty is also providing that guidance through the journal club. And then the ultrasound workshops have been super helpful. We actually have sports med fellowship trained faculty, both Dr. Raghunandan and Dr. Osment, who lead those and guide you through those. And then for research, just the requirements, it's pretty standard. 1 QI and 1 research activity original throughout the 4 years. And then we do have a rehab research day that we've tried to get everyone to present at once. And then obviously being able to go out to AAP and PM&R to present those research if you want to. Next slide. Community involvements. We do the sports physicals. That's what this picture is on the bottom left. We do that yearly with local schools to help them out during the year. And then in the bottom other corner, that's working with one of the local wheelchair and DME companies to help them set those up. And then there's other sorts of things like high school coverage that you're able to volunteer with if you're interested in sports.
Going backwards there.
And then probably the best part is resident friendly. I think that was I went to med school here, and that was one of the key factors that made me stay here was how friendly everyone is with each other and how much everyone is really intertwined. Monthly town hall and PD check-in definitely occurs. Free parking, that's definitely a key aspect. I am very appreciative, like on the clinics that I have right now, I just like park in the like ground surface parking, just walk straight into the clinic like 2 minutes down the road. So that's always helpful. And then we have our own dedicated wellness chief to help coordinate events throughout the year, such as our mentorship program, social events throughout the year. We did one at Chicken and Pickle. There's another picture of that. And then our welcome retreat as well.
I'm just going to go through these. Here's some more.
Just a 2-minute warning.
Okay.
Yeah, just follow us on Instagram. You'll see the same photos. Okay, yeah.
Boy.
Okay. Okay, I think we're good now. San Antonio, I'm from San Antonio. Wonderful place to live, very cheap, a lot of good Mexican food, very nature oriented. Next slide. Sorry, we're running a little low on time there. And so we graduate a lot of people, particularly in pain. Usually there's 1 to like 3, 4 people who match into pain every year. And if you want to go into pain, MSK Spine, very good place to go. There's also plenty of opportunities for research to buff your CV up for any other fellowship that you'd like to do, or private practice, academic, either way, whatever you want to do. There's people in that situation and you can reach out to them. Large program means large alumni network. So next slide. So thank you everybody for listening to us. I think we've got a couple of minutes now here at the end to answer some questions. Here's our emails. You can reach out to us to chat about the program, to chat about PM&R in general, and we're very happy, all of us are very happy to chat with you about whatever it may be. I can answer this question here about sideline coverage. From my understanding is like through our sports attendings and sometimes the fellows, the local sports fellows, there's like an Excel sheet, and you sign up on that Excel sheet for whatever sport you want to do. Usually Texas is really big on football, so when football season there's like tons of high school football games that you can do some sideline coverage on. And then there's other unique opportunities if you reach out to certain attending slash have a significant vested interest in sports medicine. So you can kind of go that route as well.
Any other questions?
Anybody else?
I think I tried to answer some of the other ones that were on typed along the way.
Nice.
See, we
Also,
did such a good job. No questions.
if anyone was wondering if we are a DO, I mean, I feel like PM&R is pretty DO friendly, but eight of our 9 of our interning class are DOs. So I'll just.
If there's any questions that you think are very relevant, you can read them out loud and kind of expand upon those answers.
So somebody did ask how many people we interview per year, and what are some of the qualities or aspects that we look for in an applicant. Having heard the previous presenter, we interview 80, so a little bit more than the last program, but similar in terms of what they had said for qualities. I'm looking for people that interact well with others. We are a team-based program, and a team-based specialty. We have multidisciplinary written all over us, so it's very important that you play nice in the sandbox with one another, and also are willing to put the work in to better yourself and to better the patients. Let's see, what is the day-to-day vibe like in the program? Corey, you want to answer that one?
Yes, I could totally answer that. I'm the wellness chief, so I have my finger on the pulse of the program. But overall, the vibe is great, man. I mean, I don't know. Everybody here gets along well. I think the program, the higher ups, Dr. Seidel, Edie, Dr. G, like they do a very good job of picking people who want to be here and who will mesh with the current classes. And so everybody is like super friendly. When we see each other in the hallways, we always like stop at least for like 5 minutes, 10 minutes, just chatting it up, seeing how people are doing, particularly when the interns and stuff like that. Um, and then kind of the day to day, I mean, it depends on what you're on. If you're inpatient, it can be like, get there 6:30. If you're outpatient, 8:30, sometimes 9, especially at the VA. And then you just kind of work. Usually you get a nice lunch break, 12 to 1-ish, maybe a little bit less if you got a lot of work you got to do. And then anywhere from like 3 to 5, the day will end. All throughout, you're collaborating, you're seeing people in the workrooms. We've got a couple of workrooms where there's a bunch of people kind of discussing patients and stuff like that. So very good, very fun, and very good for learning.
I think we're getting too many messages that I can answer, and I feel like you may need to email us. I can't do it.
I'll answer another question. I don't know if we have any more time.
Yeah, go for it.
Okay. See, what types of experiences or qualities do you think programs are really looking for in PM&R applicants? I think every program is different. I think PM&R in general is a little bit more lax when it comes to like, board scores and like a lot of research and publications. I think most PM&R programs are looking for well-rounded individuals that are just genuine and care about the patients and are easy to work with. I think when students come and rotate with us, when I say like visiting medical students, I think a lot of their evaluation, not all of it, but I think a lot of their evaluation comes down to like, well, how do the residents like working with them? Of course, the attendings work with them as well, but it's like, could I see myself working with this person? Would they be a good fit for our program? And I feel like our program is pretty Very just like friendly and kind of like chill, kind of bubbly. Yeah, so.
I concur.
I don't know about IMGs. I would have to I would have to speak with our program coordinator a little bit more about that. I know there are kind of like shadowing opportunities, whether that is technically allowed. It's something that we're still kind of working on, but we are definitely open to it. I just know that we still have to abide by whatever the national policy is as well. So.
All right, sorry to cut you guys off. If people have questions, they have your email, so we definitely recommend they reach out to you guys. We really, really appreciate your time and taking the time to speak with us this evening. And as mentioned, please reach out. So thank you guys.
Thank
We'll move
you.
on to the next program.
Bye, y'all.